that I stand in solidarity with the 250,000 retirees who were promised traditional Medicare, who chose traditional Medicare, and who have a right to remain with the Medicare that they were promised and that they chose. And I'm introducing legislation known as the Right to Medicare Act, which would establish in federal law that senior citizens have a legal right to Medicare. You know, the Declaration of Independence speaks of inalienable rights, which are rights that cannot be taken away. Senior citizens should have an inalienable right to traditional Medicare, a right that cannot be taken away by any employer anywhere in the United States of America. My legislation would prohibit both public and private employers from involuntarily shifting senior citizens from Medicare to Medicare Advantage. Now, there are those who claim that there's no need to worry, that there's no difference between Medicare and Medicare Advantage, and that the medical coverage of both is identical. Now, if that were true, then why would it be necessary to substitute one for the other? And I understand that there are strong opinions on both sides of the debate. And everyone is entitled to their opinions, but no one is entitled to their own facts. And so here are the facts. It is a fact that not every doctor who accepts Medicare Advantage. It is a fact that Medicare Advantage has higher rates of denials. It is a fact that Medicare Advantage is run by for-profit private insurers whose interests are not necessarily aligned with the healthcare needs of senior citizens. Right. It is a fact that 8 out of 10 of the largest Medicare Advantage insurers have been found to have engaged overbilling the federal government. And it is a fact that 5 out of 10 of the largest insurers have been accused of defrauding the federal government. And so these facts should have New York City think twice before rushing down the rabbit hole of privatization. You know, as a society, we are judged by how we treat the most vulnerable among us. And our senior citizens are the most vulnerable. Medicare is a measure of our decency as a country. It is a promise to our seniors that should never be broken. It is the right of our seniors that should never be stripped away. And it is a public good for our senior citizens that must be protected from privatization. And protect it we will. We are going to fight for traditional Medicare because traditional Medicare is worth fighting for.